Good evening, everyone. Welcome back. Let's practice for 30 minutes and look forward to the discussion at the end. Okay, let's slow down. Let's slow down for 1 minute. Let the body cool down. Try to anchor your mind onto the center of your palm. Don't let your mind wander around. Feel the body as you slow down. Okay, let's walk back very slowly to a seat. As you walk, anchor your mind on the bottom of your feet. As you approach your seat, anchor your mind on your hands or your fingers. Feel how you're sitting down. Now we're going to quickly adjust the posture. So QiGong is basically a import from India, starting with Bodhidharma, a North Indian yogi in the 4th century. So a lot of it is very similar to the 8 limbs of yoga. The 8 limbs of yoga, one of that is called asana. That's the practice of the body. That's pretty much all we practice in the United States. So I want you to focus on the body, stretch your spine, open the shoulder, lean back the upper torso, relax the shoulder. Lean back the forehead so that the ears on top of the shoulder. Tuck in your chin so that the top of the head is on top of the spine, forming what we call one pillar supporting the sky. Now you need to loosen up your forehead, relax your forehead, relax between your eyebrow, relax your eyelids so you can actually see through your eyelashes, more or less seeing the floor and your knee. Now I want you to take the tip of your tongue and rest it on the roof of your mouth. It's where the teeth ends and the roof of your mouth begins. Just leave it there, don't push it. Close your mouth. Feel the inside of your mouth. Feel how your saliva glands is reactivated. Ensure that you are in the rest and digest mode. This posture ensure that we're not using any muscle. The muscle is called a fire element. Not using muscle also help us be in that rest and digest mode. Now we're going to continue to practice the basic of the abdominal breathing technique, just the basic. Another week, I'm going to move on from that. But right now, just the basic. So in the 8 limbs of yoga, that would be another limb called pranayama, the practice of abdominal breathing. So we're going to start by just knowing our breathing, knowing our breath. Most of us don't even know our breath. Know that we're breathing in. Know that we're breathing out. Now I want you to anchor your mind on the belly button. As you know that you're breathing in, I want you to take that belly button and use your mind and bring it across the room. The body will follow. The stomach will open, the diaphragm will be pushed down. And as soon as you know that you're breathing out, I want you to take that belly button, just your mind, and bring it back Bring it all the way back to the spine. You notice that the body would follow. The stomach collapses because the diaphragm is moving up. Breathe in, forward, breathe out, backward. That's all. Okay. We're going to practice that basic technique for another week. So a week from today, we're going to move up from here. We're going to sit for 3 minutes practicing abdominal breathing. Okay, open your eyes. And we're going to massage a few energy points that would help you sleep. So the first one is called the Pond of Wind. So I want you to sit up straight, open your shoulder. Maybe I'll just turn a little bit so you can just see me. But since I don't wear a mic, you might not be able to hear me well. So I want you to stretch your spine again, open that shoulder, lean back, relax the shoulder. Then I want you to take two hands, lock the fingers, put that behind your head, look up, look straight ahead, take the thumb, goes down on both sides of the neck, and the cavity is called the pond of wind. So I want you to massage that. Massage it a little bit, and then press down on it, bend the neck back a bit, and hold it, and you feel very tender, maybe even hurt a little bit. Relax, massage some more. Now I want you to move towards the bottom of the ear, around the middle, on top of the bone. And then I want you to massage that too. This will relieve the stress that you accumulated all day. And then another two will be in front. And take your index finger at the beginning of the eyebrow. There's still indentation almost, and then you just press down. and then massage, and then take your thumb and feel the cheekbone, and right at the bottom of the cheekbone, press in. It hurts, right? Yeah, and then relax. And then one more. We didn't do that. This one's actually very famous. So if you take your wrist, you see the line here. Okay, now below the pinky, there's like two tendon. There's a cavity here. Just press in on that. Press in on that, and then just massage about 3 fingers worth, and then press in on that, and then massage 3 fingers worth. Okay. All right. So okay, so Claire asked the question. Thank you, Denny, again for this practice. Is some of the benefits coming from stimulating the heart meridians in the arm? Okay, so the heart actually in the Chinese they divide it into two. So the middle one is called the pericardium. That's the muscle outside the heart. And then this one is also called a heart. Now in Chinese, heart and mind are the same word. Actually, heart, mind, and center are the same word. So this one is actually more about the emotional state of your mind, and it's also called heart. And then this one is more the mechanical part of your mind. So um, now, Master Lee's technique, which in some way is a simplified technique, the students that demonstrate they don't move the arm like this. Okay, they just bring up their hand and bring it back down, bring up the hand and bring it back down, which is fine because it circulates the chi anyway. Now you notice that I do a little bit differently because I learned it differently. I learned from a different master that came from Bodhidharma, supposedly, and they're different from Master Lee's technique. They don't bend the knee. And you notice that in the beginning, I don't know if you caught that. I forgot to bend the knee because it's not how I normally practice. Um, but my way, the way I was taught, I actually bend the arm like this and bring it down, and I bend the arm like this. So I actually activate both the heart and the pericardium and the lung, right? So all of them are like that. And then actually the back of that is the small intestines and the large intestine and the triple warmer. So it actually has a lot of benefit. Um, so um, there's a lot. So mainly, my mom. I started this because my mom was having a problem uh, going to sleep, and so this definitely had helped her, and also it's start to lower her blood pressure, right? So it has a lot of benefit. But another benefit that it has is that if you have constipation, this one would help too. Because I don't know if you noticed that you pass gas. I don't know. Some of you, uh, you actually as you do this, you pass now. There's reason for that because after you do this for a while, your movement and the breathing coordinate each other. So you tend to breathe in when you raise your hand, and then you tend to breathe out when you lower your hand, right? Now, it's not taught. It's not taught. It's natural because sometimes it's very difficult to teach when you try to teach too many things at once. But it comes very naturally that after a while, you breathe in and then you breathe out, right? The body does that because actually, as you move the arm, it also moves the diaphragm. And so it actually pushes down the diaphragms so that you can breathe in, and then it lifts up the diaphragm as you put it up. So one of the benefits is that it's massaging your intestines. So that's why it would help you pass gas. So that's another benefit. So this one, so answering the question, if by heart, if you mean like this one, the heart, that um, takes away some of the anxiety, balances the mind, and so that helps in your sleep. Okay, there's a lot of benefit. A lot of benefit. Um, Now, I don't know how many of you have ever gone to a Chinese medical doctor. a traditional Chinese medical doctor. So here's how it works when you go to a Chinese medical doctor. So you walk in, he already know what's wrong with you. He already know. He look at your eye, look at your ear, and then he listened to the way you talk. He kind of pretty much know what's wrong with you. But he asks anyway. So what are you here for? What's wrong? And then he says he will ask you, are you taking medicine? Because he knows a lot of the uh, problem comes from the side effect of the Western medicine. And then he says, stick out his tongue because he want to see a tongue. And then he would put his finger on your pulse, and he's not measuring the pulse. It's actually they're taught to put energy in you, and it's like doing zona. They sense energy in you, see how the energy comes back. And they don't Chinese doctor, they don't solve one or two problems. They don't go after the symptom. They don't just say, oh, you have headache, so I'll give you some medicine to remove the headache. Oh, you have high blood pressure. They don't do that. They actually look at you as an energy system. So one of the frustration that I had with my dad passed away 2 years ago, almost exactly well, a little bit more than 2 years ago. And so in before he passed away, he started to have problem, dementia. It's just very progressive. It's very difficult. Dementia is just very, very tough. But in any case, but he was also diabetic. And so after a while, I noticed that his diabetes and his dementia were related. So, for example, we tried not, I tried very hard to not have him have too much sugar and carbohydrate and all that. But it turns out that he hides them. And so in the middle of the night, he'll come out and he'll eat the stuff that he eat, the biscuits and all that. And then when I come over in the morning, in the beginning, I don't stay over. Towards the end, I stay over. I measure his blood pressure, his glucose, and it went up. But at the same time, his brain is not working right. It's worse than normal. So I try very hard to talk to all the nurse doctor, and they said no, because they're all specialists. They're all specialists. They don't care. So when I finally take him to see a Chinese medicine doctor, I try to explain to them. I didn't even have to finish my sentence. It's all the same. It's all the same. Diabetes, dementia, it's all the same. So he's trying to explain it in terms of energy. So back to your question again, is some of the benefit coming from simulating the heart meridians? I think the benefit is really coming from enhancing the harmony in this energy system. It's not just heart, it's not just pericardium, it's not just lung or any one particular meridian. It's just that as you do this simple exercise, you're creating a harmony in your energy system because you bring your hands up and you bring your hands down and you breathe in and you breathe up, and it just creates the harmony in you, and a lot of the problems will go away. Not specific to any one thing. It's just that we're energy system. So that's the best I could do to explain. Okay. I'm not a medical doctor, so if you're sick, don't come to me. I don't know what to do with you. My job is to help you before you get sick. All right. Okay, so that's enough, right? That's enough. Okay. All right. So let's keep it up. I'll see you guys again tomorrow. Okay. Every night except Friday. Friday I have a class, right? And I don't know how many of you come to my Saturday morning class. If you don't have the time or the time doesn't allow you to participate live, take a look at the video. Okay. All right. I think the two are very complementary. In fact, one of the students, I wish I remember her name, she asked me, how the two are related, and they're different but complementary. All right. Okay. May you all be blessed with health, with happiness, and with peace, and in particular, a good night's sleep. Okay. See you tomorrow. Bye bye.